Hemorrhoids are common during pregnancy. Hemorrhoids which occur during pregnancy are quite common. The condition affects between 20 to 50% of pregnant women, and it regularly appears in the third trimester. The causes for hemorrhoids before and after childbirth are related to a couple of factors. First, the very process of carrying a growing baby and the act of delivery force blood veins to swell. It's normal that a pregnant woman will acquire an additional 2 pounds of weight from just the increased blood supply. This added blood can raise the body's overall blood pressure. Also, during pregnancy the overall volume of circulating blood increases from 20 to 40%. Second, the increased blood volume and flow to the body's lower abdominal and rectal area puts stress and increased pressure on veins. Veins can swell, itch, and start to bulge just from the rise in pressure and blood flow, and when these veins get additional pressure, they become hemorrhoids. With the aforementioned increased blood and blood flow, coupled with a marked rise in pressure on the veins, hemorrhoids in the rectal area grow. Another factor that influences hemorrhoid occurrences is the mass of connective tissue in the rectal area. This tissue becomes engorged, blood vessels fill with blood and swell, and easily become inflamed. During childbirth, and especially during labor when there may be prolonged pushing and constriction of muscles in the rectal area, hemorrhoids can result. It's fairly common that hemorrhoids occur after giving birth. All the strain and pushing stresses veins that are already under increased pressure. Another source of tension on the blood vessels is an enlarged uterus which creates pressure on both the pelvic blood vessels and inferior vena cava. Both veins and vena cava move blood from the pelvic area into the body's circulatory system. When the vena cava becomes contracted by a fetus, as they are both requiring room, rectal hemorrhoids can arise. During pregnancy, the female body releases large amount of the hormone, progesterone. This release creates extra strain, followed by a relaxation, on blood vessels. Extra progesterone also slows down the body's ability to absorb food. These actions promote hemorrhoid growth. Even though increased progesterone levels may cause hemorrhoids, the body certainly needs the hormone. The relaxing of blood vessels and accompanying lowering of stress in tendons and muscle linings permits the body to adapt to labor and childbirth with more ease. As the body works to extract all the vital nutrients and minerals from food, digestion is slower than normal. With a slower digestive rate comes additional strain on the intestines. They just work harder to get the nutrients so necessary for fetal growth. With the increased raising of pressure within and on the veins, followed by relaxation, then a change in digestive processes, hemorrhoids can develop. The body has remarkable healing abilities, and for many women, hemorrhoids will heal after childbirth. Many times, this healing process will occur without additional treatment. Still, there is a period of time the body needs to heal and recover from childbirth. If one decides to get additional help with the healing process, it's good to consult with a medical specialist, obstetrician, or colorectal expert.